Hi, I'm Sam. I'm the first point of call when you come to meet Dr. Anusha Yazdani. I am Anusha's nurse, and today we're just addressing a couple of questions that we get regularly. First and foremost, when people are trying to conceive or have fallen pregnant, we have a lot of questions and concerns about their lifestyle and changes to lifestyle. So first and foremost, the most important thing is that we are maintaining a healthy lifestyle whilst trying to conceive and whilst we have conceived, after we have conceived. First and foremost, smoking. Smoking is contraindicated in anyone that is trying to conceive or has fallen pregnant by themselves. It has a negative impact on a woman's ability to conceive, but also the health of the growing fetus once we are pregnant. Okay. The next question that we get asked a lot is, can I have coffee or can I have caffeine? You can. However, it is recommended that women trying to conceive or have conceived limit their caffeine intake to about 200 milligrams a day or a standard coffee a day. Okay. Can I work? Yes, you can. Everyday life, everyday work can continue as per usual. Your little embryo or your little baby is very well protected in the uterus when we are pregnant. Okay. Can I lift other children? Can I lift heavy objects? Yes, you can. Again, that little baby or embryo that we have put back is very protected within the uterus, and lifting objects isn't going to affect things. In saying that, if you have a high-risk pregnancy, your specialist will tell you whether you need to stop doing certain activities. The next question we get is, can I take Panadol or Panadeine as a painkiller? Yes. Panadol and Panadeine are first-line painkillers when we're looking at conceiving, and also once we have conceived. They've been shown to have no effects on mothers or growing babies. Okay. We find that many of our women have or are involved in acupuncture treatments, and we get asked a lot about can they continue with these treatments? Yes, they can. The number one thing is just letting your specialist know that you're continuing with these treatments so that we're aware. Okay. Can we use a spa or a sauna? Straight up, no. The reason for this is spas and saunas are known to increase your core body temperature rapidly, and the little embryo or little fetus doesn't tend to like this. Okay. Zika virus testing. We have a lot of patients that go overseas for holidays, and that's completely fine. Travel is completely fine. That will come in another episode. But Zika virus testing is recommended for anyone that has gone to high risk or moderate high risk countries. For people that are showing no signs or symptoms and are looking to conceive, we recommend doing the first lot of testing 4 weeks after you return back from a Zika infected country. Anyone that is planning to conceive or is pregnant, it is recommended that you don't travel to Zika virus affected countries. Vaccines. We constantly get calls about when or what vaccines we can have, and there's a couple when we are looking to conceive or are pregnant that we recommend, and there's a couple that need to be looked at after we conceive. Okay. First and foremost is the flu vaccine. Completely fine for anyone wanting to conceive or have conceived to have the flu vaccine. In fact, it's actually recommended that pregnant women have that flu vaccine when we are entering into the flu season. Next is whooping cough. Whooping cough is recommended for anyone looking to have a baby, but in saying that, if you're planning to have a child and your whooping cough vaccine is not up to date, the recommendation is to wait until you're within your 3rd trimester, and this is because that then provides baby with some antibodies from that vaccine as well as yourself. Partners, it's recommended that partners or people close to that baby will have that vaccine as well. Measles, mumps and rubella, that vaccine is contraindicated once we are pregnant, and it is recommended that if we're trying to have a baby, we don't have that vaccine in that month before we start trying. If it is required, we can have it postnatally, that's fine. And the tetanus vaccine, not that that occurs often, but if it is required during pregnancy, it is completely fine to have.